It is very nice to greet you again. In today's video we will talk about the following. How long can a dog live with rabies? Rabies is a viral disease that poses a significant risk to both animals and humans. One of the crucial questions is how long a dog can survive after contracting rabies, highlighting the need for preventative measures such as vaccination and immediate action if rabies exposure is suspected. 1. Transmission and incubation. The rabies virus is primarily spread through the saliva of infected animals, often via bites or scratches. After entering the host's body, the virus travels through the nerves to the brain, a process that can take weeks or months. During this incubation period, a dog may appear healthy, which can be misleading, as the disease develops asymptomatically. 2. Symptoms and prognosis. When symptoms finally appear, the situation is critical. The first signs can mimic those of other illnesses, including behavioral changes such as increased aggression or unusual friendliness. As the disease progresses, the symptoms worsen, leading to difficulty swallowing, excessive drooling, and paralysis. Once clinical signs of rabies appear, the prognosis is poor, as the disease is almost always fatal. The time from the onset of symptoms to death can range from a few days to several weeks, underscoring the urgency for pet owners to act quickly if rabies exposure is suspected. 3. Preventive measures. Vaccination is fundamental for the prevention of canine rabies. Most countries require vaccination, which is usually administered around 3 months of age, with booster doses every 1 to 3 years, depending on local regulations and the type of vaccine. Keeping a dog's vaccinations up to date is crucial for its health and the safety of the community. In the event of a dog bite or possible exposure to a rabid animal, immediate veterinary attention is crucial. The veterinarian may recommend a series of rabies vaccinations, depending on the situation. If a vaccinated dog is exposed, immediate treatment significantly increases the chances of survival. 4. The emotional impact. Dealing with rabies can generate overwhelming emotions for pet owners. The prospect of a beloved dog suffering from such a brutal disease can evoke feelings of helplessness and fear. Understanding the reality of rabies allows pet owners to make informed decisions about their pet's health and safety. 5. Education and awareness. Learning about rabies and its transmission is vital. Knowing the symptoms of rabies and understanding how the disease spreads allows pet owners to take proactive measures. Avoiding contact with wild animals and keeping dogs on leashes can help reduce the risk of exposure, especially in areas where rabies is prevalent. 6. The importance of prevention. The life expectancy of a dog with rabies is tragically short, underscoring the urgency of preventative care. The focus must be on prevention, as treatment is rarely effective once symptoms appear. Rabies affects public health, with consequences that extend far beyond dogs and their owners. Ensuring pets are vaccinated can collectively reduce the incidence of this deadly disease. 7. Coping with a diagnosis. If a dog contracts rabies, the focus shifts to its well-being and care. Euthanasia may be recommended to prevent further suffering, as there is no cure for rabies once symptoms manifest. This decision, while challenging, is often the most humane option for an animal in distress. The emotional impact of losing a pet is profound, and seeking support from friends, family, or professionals during such a difficult time can be beneficial. It is a pleasure to inform you and help you. If you have not subscribed to the channel, you should do it now. Take care of yourself and your furry friend. A hug, and until the next video.